Do you work at a hospital? Hospitals can play a pivotal role in shaping treatment trends for different diseases and conditions. They become practical test beds for new innovative treatments that can provide relief to those patients who need it the most. Hospitals often collaborate with healthcare providers, and their treatment decisions can influence the care provided in other settings. For example, a study published in JAMA Internal Medicine in 2016 found that the treatment choices made by physicians in hospitals can significantly impact the use of antibiotics for common infections like urinary tract infections and pneumonia. The study found that physicians who treated patients in hospitals with lower rates of antibiotic use were more likely to prescribe antibiotics at lower rates themselves. The TrapEAZE technique founder got the idea of getting it into the hospital level from visiting various hospitals like South Lake Hospital in Florida, where he presented his overactive bladder treatment to their urology department. He also did the same at Massachusetts General Hospital Radiology Department when he was COO of a medical device startup in the surgical drainage niche. In order to get the TrapEAZE technique established at the hospital level, Less Pain More Gain LLC is now giving away complimentary access to a very limited number of practitioners. If you are a physical medicine rehabilitation physician or a doctor of physical therapy, simply email Dr. Justin at drjustin@trapeazetechnique.com for details about eligibility and use the subject line Hospital Use. Your future upper back pain patients will be glad that you did.